Senator Hellam.
Thank you, Mr. Chairman. First, I'd like to take a moment to acknowledge our witnesses that are here today and some of the families, but in particular, Ms. Selke and Ms. Pilata. As a committee, we truly do admire your bravery, your strength for coming here today to talk about your sons. And we can't begin to imagine your loss. But your sons served our country with valor. And in honoring that, we must take care of every veteran from here on out that comes home. Need to be taken care of. So, Chairman Sanders and Ranking Member Burr, I want to thank you for bringing this issue in front of our committee, especially because the impact that it has on veterans throughout the state of Nevada and across this country. It's easy to put this in perspective for me. Between 2008 and 2012, 593 veterans from Nevada were lost to suicide. 6 months ago, I may have looked at these numbers and asked why it was so high. What is missing within the VA or the VA benefits that so many veterans across this country resort to this? I think we know now that a big part of the problem is veterans' access to care at the VA facilities. This is such a critical issue to get right at the VA because of the rippling effect that it has on veterans' well-being. Whether it's a medical care, mental health treatment, or support during transition to civil life, veterans being forced to wait for care from the VA can be very detrimental. That's why I've asked the Las Vegas VA director to send me reports about wait times for primary care, specialty care, and the mental health treatment for Southern Nevada veterans. Every 2 weeks, for both Las Vegas and Reno, I track these numbers for improvements. In the most recent data, patients already receiving mental health care from the VA facilities in Nevada wait a week or less for appointments. Unfortunately, the average wait time for new patients seeking mental health treatment is 23 days in Reno and double that in Las Vegas. Even worse, a clinic in Northwest Las Vegas has an average wait time of over 64 days for new patients. Veterans in need of mental health treatment absolutely cannot be waiting more than 2 months to be seen. I've been pushing every one of these facilities to improve their wait times in the coming months and want to hear from the VA today about their resources, what resource it will be devoting to mental health treatment. We must also remember that scheduling an appointment is not the only barrier to receiving care. Veterans must also qualify for this care. One of the best ways to ensure veterans qualify for mental health services is by reducing the VA's disability claims backlog. Veterans with post-traumatic stress who have PTS-related claims approved will be able to access VA's mental health services and treatment. This claims backlog is an issue that I've brought up during every committee hearing because I believe it should be a top priority of the VA and of this committee itself. That's why I sent a letter to the chairman requesting that he reschedule a legislative hearing to consider my bipartisan bill to address the VA claims process. Nevada veterans have one of the longest wait times in the nation at 248 days on average to complete a claim, and 240,000 veterans nationwide are still waiting, longer than the VA's 125-day deadline. Until this backlog is eliminated, veterans in Nevada and throughout this country will continue to face delays to access to the mental health treatment that they need and deserve. With 22 veteran suicides a day, nearly 600 veteran suicides in Nevada over the last 5 years, it is clear something must be done to improve the current state of mental health services at the VA. The VA facilities in my state know that I will use my oversight role in this committee to continue holding them accountable for performances, timeliness, and the quality of care they provide to Nevada veterans. I look forward to hearing from the witnesses today about the VA and about what the VA is doing to address this crisis, how Congress can help in this effort. Mr. Chairman, thank you.
Thank you, Senator Hellam.